All right, Iowa's Cancer Registry just released its annual report on the state of cancer in Iowa. Jonas Evans spoke to experts to understand what's in that new report. Good evening, Jonas.
Well, John, a lot of the same. Iowa is still seeing some of the highest cancer rates in the U.S. In fact, it's #2 in the country among states for all cancers, including among young adults. The experts I spoke to today said the numbers are concerning, and their solution is in legislation.
Unfortunately, it's same story, different year, as it we still have the second highest cancer incidence rate in the country in Iowa.
The 2026 Iowa Cancer Report is projecting nearly 22,000 new cancer cases this year and 6,400 deaths.
But we have a declining mortality rate that's very similar to the rest of the U.S. So that's the good news story. The bad news story is really lung cancer.
Nearly a quarter of all cancer deaths in Iowa came from lung cancer.
We know what causes it, but we as a state have not enacted some of the policies that would be really helpful in bringing our smoking rate down further.
We know that increasing the price of tobacco products, and so cigarettes, can have a significant impact on reducing smoking rates and ultimately lung cancer and deaths from lung cancer.
This year's report studied 89,000 farmers to see how cancer affects them and their families. The industry can be a cause for concern given their work for pesticides, but this year's data didn't show a significant correlation.
Farmers tend to have a healthier lifestyle. They have to be more active. They have to be healthy enough to be a farmer. Pesticides may still be, an important contributor, but it can be a little bit offset by different lifestyle factors.
There hasn't, however, been extensive research on how pesticides affect those living near a farm.
It's a really important question, and I would say that Iowans are incredibly passionate about this question and finding solutions to it. So if there are efforts to reduce and monitor, perhaps, so that we know what we're dealing with, that could be very helpful in reducing potential risk associated.
And several cancer-related bills are moving forward this session in Iowa. Those proposals include expanded coverage for breast cancer and a tax hike on tobacco products, funding for water quality monitoring, and coverage for lung cancer screenings did not survive last month's first funnel deadline. John, back to you.
Jonas, thank you.